I think Matt's taken exactly the right decision. It's okay having the support and the confidence of the Prime Minister, but in a pandemic, you've also got to have the support and the confidence of the public. And although I think they had some sympathy with him over the affair, it wasn't that. It was the perceived hypocrisy of telling people to do one thing and doing another yourself and breaking the rules. And that has made his position untenable as Health Secretary, because, as I say, you've got to have the confidence and belief of the people, and Matt had sadly lost that.
Shouldn't he have just gone yesterday rather than dragging it out and getting the Prime Minister to give him his support?
With hindsight, he probably should, although we're quite near the end of the pandemic, and I'm sure that he wanted to see it out. But at the end of the day, it's okay having the Prime Minister's confidence. The Health Secretary's got to have the public confidence. And it became apparent overnight that the newspapers were going to continue printing headlines that were undermining public confidence. And obviously, colleagues such as myself, our inboxes were filling up with constituents who were calling for him to go. And we've seen this before, and his position became completely untenable.
What can you say to constituents then who have been emailing you? Can you defend what's happened?
Well, I was on the media yesterday, and I said that as far as I was concerned, it was a private matter. However, if Matt Hancock believed that the situation he got himself in had undermined his ability to perform his duties as Health Secretary, he should have resigned. And if the Prime Minister thought that Matt Hancock's performance of his role had been undermined, then he should have sacked him. Clearly, that wasn't the case. Matt had apologised for breaking the social distancing rules, but clearly, when you're not just having to abide by the rules, but you're making the rules yourself, that puts him in an invidious position. And the accusations of hypocrisy were there for all to see.
And really, his position was untenable, wasn't it? I mean, growing calls from the opposition, but now more and more Conservative MPs saying he couldn't stay.
Yes, well, I've spent the day with volunteers up in Batley and Spen at the by-election, and clearly the issue with Matt Hancock had dominated the headlines for the last more than 24 hours, and it was a topic on the doorstep. And I think people had some sympathy for him. They think he's done a pretty good job during the pandemic in an enviable task. However, I come back to my point. During a pandemic in particular, it's absolutely essential that the Health Secretary had the confidence of the vast majority of the public. And clearly he'd lost that in the last 24 hours. That means he had to resign.
What do you think of Matt Hancock as Health Secretary? Do you think he did an effective job? Has he had your confidence?
I've not agreed with some of the issues he's taken. The linking of my constituency with the city of Leicester for local lockdown purposes basically condemned my constituents, whatever they did, that they were going to be in lockdown pretty much continuously. I would have lifted the restrictions of the lockdown probably far earlier than he has, but they've gone for a cautious approach. Fortunately for this country, the procurement and rollout of the vaccine has been such an excellent job compared to our competitor economies. The government's been able to have the luxury, they see, of a very cautious lifting of the lockdown procedures. I'm afraid I do think that the cost of lockdown has not been calculated yet. The cost of mental health, well-being, the backlog of cases for the NHS, and that's going to take a lot of dealing with. I think we'll be very sceptical about using lockdowns as a prevention measure to control situations that we've been in for the last 18 months when we get the full reports of how that has damaged our society and our economy.
And of course, this week in England, we were supposed to have so-called Freedom Day on the 21st of June. And here we are talking about the Health Secretary, or now the now departed Health Secretary.
Indeed. And I think what the government have had to row back on is that the figures that we were given. I didn't vote for extending lockdown. I voted against it the other week. But those figures were spurious. They were outdated data. And that we've broken through vaccination, excellent vaccination process. We've broken the link between infections and hospitalisations and fantastic that we're not having the level of fatalities.
Conservative MPs, many don't like Matt Hancock, do they?
Everybody in politics, there's an old saying in politics: if you want a friend in politics, get yourself a job. And one thing for sure in politics, when you're in trouble, like Matt Hancock is, there aren't many friends about, unfortunately.
Perhaps the Prime Minister. Now, I want to ask you what damage this might have done then to the government's chance. We've got this by-election, as you mentioned, Batley and Spen coming up on Thursday. How much damage has been done?
Well, I was up in Batley and Spen with my volunteers 3 weeks ago, and I've spent the day up there today, and it doesn't feel a deal different. I think the Conservatives have got every chance of winning that seat. And the Labour activists I saw looked fairly demoralised up in the constituency.